This exercise that I'm going to show you today should be done by every woman who wants to stay beautiful and young for as long as possible. And men should also do this technique because it directly affects their energy, their productivity, and their zest for life. I don't understand why people ignore this problem because it causes headaches, ringing in the ears, and dizziness. Loss of productivity, loss of energy, constant chronic fatigue, brain fog, impaired vision, facial swelling, facial asymmetry, and dark circles under the eyes. You may also experience increased anxiety and even panic attacks. And all these problems arise from just one small bone called the atlas. And you can find plenty of scientific publications about it. These publications state that dysfunction of this bone leads to health problems and worsens your appearance. In this video, I'll explain what risks this bone can pose, and most importantly, I'll give you recommendations and exercises you can do at home to help yourself. And before we start, make sure to give this video a like so that as many people as possible can see it and help themselves. And it's very important to understand how to properly massage this area, and so you get the results you want. Now, let's see why the atlas is so important. The atlas is the first cervical vertebra. Here, it's highlighted in blue. You can see it right here. If we look at it in isolation, this is a bone that doesn't have a vertebral body because you can see the round hole inside through which the spinal cord passes. And here, on the sides, you can also see the transverse processes. See those little holes? An important vessel passes through those holes. That's the vertebral artery. And many different muscles attach to the atlas. You can see them marked with these red and blue dots. The muscles that attach to the atlas are shown here. There are a lot of them. They affect the position of the atlas. So, all these muscles that attach here, they can cause the atlas to shift to the left or right. What does this lead to? The thing is, when the atlas shifts, it can cause a spasm of the vertebral artery. And here you can also see that a lot of different nerves pass through this area. And especially if you look at this model, you can see the occipital bone. This is where the reptilian brain is located with its vital centers. And it is located in the projection of the occipital bone next to the foramen magnum, and here is the atlas. If you look, there are many different muscles under the occiput. These are the occipital muscles, small occipital muscles, which are often prone to spasms because they frequently tense up as a compensatory reaction. If there are posture problems, for example, if there is scoliosis, these muscles will be out of balance on the left and right sides. If there is cranial asymmetry, if there have been head injuries, this will also cause these muscles to be tense, and the atlas will be blocked. This will lead to the blood vessels here being compressed, and this will lead to a vegetovascular reaction because all blood vessels are covered with nerve tissue, and any pressure on a vessel in this area causes stress and tension. So, even if there is just a little compression in this area, that is, pressure on it, even with a finger, if you touch it, the vessel starts to spasm, triggering an excitation response, stress. And this signal of stress and excitation is transmitted to the vessels in the brain. This causes spasms and various vegetovascular disorders, which can lead to headaches, vision problems, ringing in the ears, and even hearing loss. By the way, as an osteopath, I often observe this. I work with small children, and if there were any birth injuries, this area, it is very sensitive, and it is the first to get injured. This shows up as posture problems in the child, constant slouching, asymmetry, dark circles under the eyes, delays in speech and mental development. This is how dysfunction of the atlas affects a child. If we take an adult, if they have decreased concentration or lower energy levels, it's because this area affects blood flow, and not only that, it can actually get worse. Let's apply. And also venous outflow, because venous outflow also passes through this area. This leads to the head feeling heavy and swollen. You get brain fog, and your mind starts working less clearly. For both women and men, this also affects appearance. People develop chronic bags, dark circles under the eyes, persistent forehead swelling, and puffy eyelids. The face as a whole becomes puffier because 85% of all the blood fluid from the head drains away through this area, which is located next to the atlas vertebra. That's exactly why it's so important to work with this area. And besides that, there is also a structure called the dura mater. It covers the brain and the spinal cord. It's a protective membrane. Any injuries to the tailbone, sacrum, skull, or even the spine can cause spasms that are transmitted here. As an osteopathic doctor, when I examine patients who come to see me, I always check the atlas vertebra. If the atlas is in a state of tension or dysfunction, I understand that the problem could actually be elsewhere. In fact, it could be in the skull or the sacrum. Because I know that any injury, even if someone just fell on their tailbone, will also cause tension in the atlas. And even more so with incidents like, for example, a car accident. Whiplash, when there's a sudden flexion and hyperextension of the muscles. This leads to all the muscles becoming rock hard. And of course, here you have the symptoms, plain as day. So, friends, I can say that 90 to 95% of people have, if not a pronounced displacement in this area, then at least a spasm that will worsen your condition. And there's a simple solution you can use to influence this and start feeling better. Before we move on to the technique, I suggest you first diagnose whether you have a displacement of this vertebra or not. That is, there are serious displacements that can be detected on an MRI or CT scan, and which require medical intervention. But most often, a subluxation occurs, a slight displacement caused by muscle spasms, and these muscles can pull the atlas vertebra to the right or left, or cause it to rotate. This happens when it rotates to the left or to the right. Because of this, when you palpate the transverse processes, you might feel that it seems to stick out somewhere. It looks like a displacement, but in reality, you can try to influence it by relaxing the muscle. But it's worth trying on your own first. And one more important point. Under no circumstances, if you detect a displacement, should you attempt to set it back yourself. Because all of this can only trigger a reaction from the vascular and nervous systems and just make things worse. I recommend working gently and safely. So, friends, how do we diagnose the atlas? Where is it located? It is located right under the occiput. If you slide your hand down from the back of your head, you'll reach a little hollow under the occiput. The atlas is located right in that hollow under the occiput. Next, if you go, you can palpate the spinous process of the second cervical vertebra. You move along the back of your head, go down, down, there's a hollow here, and then you'll feel a protruding process at the back of your neck. That's the second cervical vertebra. So, the atlas is located just above, right where there's a hollow, exactly at the transition point. The atlas doesn't have a large spinous process, but it does have large transverse processes. And you can actually see them. Here they are, see? They stick out on the sides. That's where you can find it. So, right here is the occipital bone. If you move your finger from the outer ear canal downward, you'll feel a bump here. This bump is the mastoid process of the temporal bone, and right below the mastoid process of the temporal bone. So you slide off of it, and you land on the transverse processes of the atlas. If you go further down, that's just the neck. You won't feel anything there. So these small bumps are what stand out, and above them are the larger bumps. And right where these small bumps are, you place your finger and check how it feels. Are you on it? Is it shifted to the left, to the right, or not at all? Because sometimes, when it's shifted, you might feel that it sticks out more on one side, and on the other side there's a dip. Everything should be symmetrical. So, large bumps, and then smaller bumps further down. That's the first thing. Second, you can apply gentle pressure. You can even do it like this, moving your head to the left and right. Look, how does it move at all? Sometimes you might notice that. It shifts easily to the left, but to the right it gets stuck and doesn't move. Similarly, you can place your fingers and tilt your head back and bend it forward. Extension and flexion, and see if it moves symmetrically or not. You can also do rotation. Right, left. And in all positions, you check. Your left and right sides should be symmetrical. If you notice that something has shifted somewhere, something's not right. We won't get into complex biomechanics or osteopathic concepts, or the different dysfunctions of the atlas, but what's important for you to understand if you find a dysfunction. Accordingly, you need to work on balancing the occipital muscles in order to return the atlas to its normal position. And that's what we're going to do now. Friends, I hope you'll thank me for this technique. It's truly unique. All you'll need are just 2 tennis balls and a sock. And honestly, it might seem simple and even a bit funny, but this is a serious technique. You will take the 2 individual balls and carefully put them into the sock so that they are positioned closely together. In other words, gently press them firmly so they are snug and secure against each other. Then, pull the sock quite tight and subsequently tie it securely in a strong knot. Just take it and tie the sock in a knot, and now you have tennis balls. They have just the right amount of firmness, not too soft and not too hard, making them perfect for the cervico-occipital area. So, friends, let's do the exercise. The first exercise. We're going to work with the occipital bone. Find the occipital protuberance. It's the bump right on the occipital bone. Go ahead and find the bump. We need to work with this area. You place it here. There's a lot of tension that builds up in the occipital bone, and inside here, you can see these grooves. Venous sinuses pass through here. We need to improve venous outflow and also relax the thickness of the bone so that these muscles start to relax. So, you find the bump and place 2 balls between these bumps, then lie down on them. That is, the balls are under you. Right here. How long should you lie there? You need to lie for at least 1 minute, preferably 2 to 3 minutes, because I noticed that good relaxation starts after about a minute. How can you enhance this relaxation? If you relax, close your eyes, and enter a light meditative state, relaxed, quiet, peaceful. If you let go of the tension in your head, you'll feel all your tension start to leave, dissolve, and flow down through your body. You can even imagine how, through these balls, the tension from your skull is draining away. And you just lie there for a couple of minutes, 2 or 3, until you feel the back of your head start to soften and relax. This alone will bring relief to that area. After you've been lying there for a minute or 2 or 3, what do you do next? Next, you move these balls a little lower, right to the spot where the atlas is, onto these muscles, right here. So you roll them, starting from the bump, and keep rolling them like this, right into the hollow. That means you tilt your head back a little, but make sure the back of your head doesn't touch the floor, so that the pressure stays on the balls. That's it. Now the pressure is under the back of your head, right here, in this area, and you relax as well. I recommend taking a deep breath, and as you exhale, let go of all the tension. And as you lie there, the back of your head starts to drop down. These muscles gradually begin to soften and relax. And the atlas, which is inside, also relaxes. And these muscles relax as well. Exhale all the tension. 2 to 3 minutes. Just lie there and rest. Feel how all the tension from your head starts to flow out through these balls, through the table, down to the floor. After you've done this, you can even involve your eyes a little bit. Look to the left and to the right. When you look left and right, notice that when you look to the right, the tension increases on the right side. Then look to the other side, to the left, until you feel the muscle tension and exhale everything out. After you've done this, we need to work with the side muscles. What do you do? Now, from this position, you move the ball to this position. That is, starting from the spinous process. You place it to the side here, so the second ball goes under the mastoid process, like this. And I place the ball here and here. So now I'm working with different muscles, and I'm relaxing. So, a slight turn toward the head, I take a breath in. And exhale, gradually relax. Until the discomfort goes away. When you start to feel warmth, that's a sign that relaxation is happening. Gradually, you'll feel everything getting softer and softer. So, if the balls were very sensitive and painful at first, the discomfort will go away over time. Also after a few minutes. Then we move to the other side. Do everything symmetrically. Move to the other side. And here I am. Here are the spinous processes, and here's the ball. I turn my head to the side and lie down. So, one ball is working on the transverse process, and the other is here. This area is being massaged and relaxed. These are very powerful techniques that I recommend doing for 1 to 2 to 3 minutes. What else can you do? You can do rolling movements. Just place the balls right here, also in the area where the muscles are, where the neck transitions, and make these kinds of movements, see? By supporting the head at the occipital and temporal bones. You start to rotate your head with your fingers, not by tensing your muscles, but with your fingers. So let's roll, friends. I've just shown you some really powerful techniques. I use them myself and recommend them to everyone. Say thank you for them. But I also encourage you to work through the story more deeply. Because, as I said, the skull, from the bridge of the nose and the eyes to the coccyx and pelvic floor, is all one system. If there was an injury to the coccyx or sacrum, if there's dysfunction there, or if there's tension in the dura mater, if there were injuries to the skull, the frontal bone, the eyes, the bridge of the nose, or the ethmoid bone, all of this will also lead to spasms in this area, which is why I strongly recommend working holistically. In other words, you may have released this area, but you also need to work on other areas. And for this purpose, I highly recommend Rejuvenation course on my Mind Body Face platform. You will lift your face, tighten your body, improve well-being, body condition, get rid of wrinkles, and look 5 years younger in one place. Join link in description, so be sure to follow the link below. And also, friends, please write in the comments what sensations you experienced after trying this technique. Because right now, the back of my head is burning. I feel light and relaxed, and I guarantee you that if you do this regularly, your health and appearance will improve dramatically. This was Dr. Alice with you. Don't forget to subscribe to the channel, and see you in the next videos.